Today at Onsalus Health, we discuss the potential causes and treatments for vaginal spotting that occurs specifically during cleaning. So, let's get started. Number 1. Contraceptive use. Women taking hormonal contraceptives, such as a pill or injections, may experience spotting after treatment. This bleeding, known as breakthrough bleeding, occurs due to changes in the uterine lining caused by the contraceptive hormones. It often resolves on its own and is usually not a cause for concern. However, if the spotting causes significant discomfort or persists, a doctor might suggest changing the type of contraceptive. Number 2. Hormonal changes. Natural hormonal variations can affect vaginal tissue, making small bleeding more likely, especially during ovulation. This bleeding is typically light and short-lived. Number 3. Implantation bleeding. This type of bleeding occurs when a woman becomes pregnant and the fertilized egg implants in the uterus. If this video is helping you answer your questions, consider supporting the channel through a super thanks. Number 4. Polycystic ovary syndrome. Women with this syndrome often have higher levels of male hormones, or androgens, leading to spotting and irregular periods. Treatment typically involves medications to regulate bleeding and lifestyle changes. Number 5. Uterine polyps or fibroids. These benign tumors in the uterine lining can cause spotting, difficulty getting pregnant, constipation, and pain. Small, asymptomatic polyps often resolve on their own. In other cases, a doctor may prescribe hormonal medication. Number 6. Sexually transmitted infections. Infections like chlamydia are common and can cause intermenstrual spotting, along with symptoms like fever and abdominal pain. These infections are usually treated with antibiotics, either as a single dose or several doses over 7 days, depending on the diagnosis and prescription. Number 7. Perimenopause. As women approach menopause, hormonal changes thicken the uterine lining, making period tracking difficult and causing spotting. Treatments may include estrogen-based hormone therapy, antidepressants, or gabapentin. Number 8. Cancer. Cancer can affect any reproductive organ, such as the uterus, and typically occurs in postmenopausal women, though younger women are not immune. Treatment is managed by a gynecological oncologist and varies based on the case. Well, that's it for today. Thank you for watching. As always, don't forget to like this video and subscribe to our channels for more videos like this. If you have any questions or suggestions, leave them in the comment section below, and until next time.